Good day, sir. My name is Anches Dang Jr. From 12K Group 42. So today I'll be performing my return demonstration in immediate newborn care. So immediate newborn care is vital for identifying and addressing for any health issues in the newborn, and it can be immediately apparent. So prior to the procedure, I'm going to do hand washing. So now I'm going to prepare the necessary equipment, which is the ointment for the eyes of the baby, dry cotton balls, clothes of the baby, forceps, with the vitamin K, the measuring tape, and then the sterile gaussian swab, and then a pair of gloves, and sterile gloves, and then tuberculin and a thermometer. So next, I'm going to weigh the baby. So now I'm going to put on a sterile glove. So going to open the sterile glove. So I'm going to put aside the packaging of the outer layer of the pan. Open it. Remember, do not touch the outer layer of the gloves because it may be can contaminate the gloves. Next, your other hand. So next, I'm going to now weigh the baby. Okay. So after I weigh the baby, I will proceed to the cord dressing. So now I'm going to begin with the cord dressing. So first I'm going to put on a sterile gloves, which I already put on. So next, I'm going to properly restrain the upper and lower part of the newborn extremities. So first, I'm going to restrain the upper extremities. Then to the other side. Then put the forceps. Then put down from the lower extremities. So now I already restrained the upper and lower part of the extremities. Now I will begin to cut the cord. So first I'm going to using cotton ball. I'm going to disinfect the cord 3 times from the base to the upward. So from the base to the upward, then disregard the base, the upward, disregard from the base, the upward, and then disregard. So next, I'm going to place a sterile gaussage pad to the base of the cord and clamp the cord with an umbilical clip with half inches from the base of the cord. So I'm going to put a gaussage pad. So next, I'm going to clip the cord. So next, I'm going to cut the cord about 5 centimeters above the cord clip and express the remaining blood from the cord with the sterile gaussage pad placed on the base of the cord. So now begin cutting. Remember, only an inch apart. So disregard the upper part of the sterile. Now I will begin now to guard the umbilical cord. So now I'm going to place again with another sterile dosage pad to the lower the on the base of the umbilical cord, and then I'm going to spray on alcohol that is only 70%. So now I'm going to I will begin with the vitamin K injection. So I'm going to inject the baby in the middle third lateral aspect of the initial thigh. So now I'm going to get the injection and open the injection, and then get some air. Okay, then I'm going to insert it, then release air, then get the inches, then use the air. Okay, so now we'll inject it. So now I'm done. So I'll proceed with the measuring of the So now I will carefully get the anthropometric measurement of the newborn, starting from the head. Newborn. Okay, next is from its chest, under his or her armpit. Then next for the abdomen. Then I'm going to measure the length of the baby, starting from the head to toe. So don't forget to document the length of the head, chest, and the length of the baby. So next I'm going to temperature the baby rectally. So I'll turn the baby sidewards. So the baby is 37, the normal temperature of a newborn. So now I'll proceed to the initial bath of the baby. So now I'll begin with the initial bath. So before I begin, I already double my gloves to separate the wet gloves and the dry glove. So now I'm going to carefully so now I'm going to hold the newborn in a football grip manner, folding the both ears, and carefully washes the newborn's head with the use of a baby soap or a mild shampoo. So I'm going to wash now the baby's head. Then I'm going to apply a baby shampoo. Then I'm going to wash off the shampoo. Then I'm going to dry so now I'm going to wash the baby's face. So now I'm done with the initial bath of the baby. So now after this, I'm going to dry the baby, and I'm going to remove but first I'm going to remove the gloves. So now I already remove the wet gloves. So now I will proceed to dry the baby. This is to avoid the baby to get cold. So next, I'm going to put on the baby's mittens, clothes, and diaper. So next, the baby's shirt. Next, for the baby's pants. So now I'm going to wrap the newborn securely with a clean blanket. So now I'm going to place the newborn in a crib with a drop light on and a drop light that and attaches on the cream towel. So now I'm going to place the newborn in the crib with a drop light on the and attaches the cream towel. So now I'm going to next I'm going to the application of Creed's prophylaxis. So I'm going to shade the newborn's eyes from the light and open one eye at a time by exerting a gentle pressure on the upper and lower lid, and then apply the ophthalmic ointment from the inner to outer canthus, making sure that the tip of the medicine tube will not touch the eye of the newborn. So I'm going to get the ointment. So now I'm going to open the eyes of the newborn and be careful not to touch the point of the droplet into the eyes of the newborn. So from the other eye. Okay, so now I'm done putting the ointment. So next I'm going to measure the baby's vital signs and respiratory rate. So after that, I'll document my findings. So for the documentation of the newborn care. So now for the documentation of the procedure. Done, I have included the weight of the newborn is at exactly 7.5 pounds, which is the normal weight. And the heart rate is at 120 beats per minute, and which is the normal rate of the heartbeat. And the respiration rate is at 30 breaths per minute, which is a good sign for a newborn. And the temperature is at 37 degrees, so which is a normal temperature of the baby. And also the head circumference, and also I measured the body, the newborn body. So the head circumference is exactly 32 centimeters, and the chest circumference is 26 centimeters, and abdominal conference is 27 centimeters, and the length of the newborn is 40 centimeters. So that's it for the documentation, and all the findings are normal. So that's it for my return demonstration in newborn care.